so it won't continue to happen. My interest with regard to BREEZE, what does BREEZE stand for?
It doesn't stand for anything.
It's not an acronym,
No.
okay. My interest is, right, it stands for nothing, right? My interest in a go-forward basis is because the maintenance contracts can be nothing short of extortion themselves. Once they get your codes and whatever, then they've got you and you've got to keep going back. So my interest is, what must the legislature do to guarantee your success in rolling out the next phase or two of BREEZE or BREEZE 2, 3, 4 versions? Within your realm. We're
Sure.
clear the 2010, 2011 contract, junk. We're clear about that. But based on what you know today, based on what you've learned, trial by fire from this experience, what must the legislature know and do to improve the likelihood of success?
I definitely appreciate that question. I would say, to your point about the maintenance contract, this body will be pleased to know that there are provisions in that maintenance contract that we can sever once we build up state staff knowledge and expertise so we can reduce costs. That was a lessons learned from previous contracts. Senator, to your question about going forward, how do we not repeat this, and what I need as an executive to do this job better. As I've come to you in the past, I will come to you in short order. I need resources. That will be brought to Budget Committee in a few weeks, and the resources are ongoing. It is to make sure that we have the internal resources needed to do the changes, the minute changes that my boards and bureaus need, changing how something looks on a website, adding a license type, changing a license type, adding a requirement. All of that requires staff. And now that we are supporting now 2 legacy systems, the resources that we'll need will have to have the knowledge to really learn the BREEZE system and also prepare for the transition to, after the cost-benefit analysis, how do we leverage this staff, the resources that we've invested for the boards to come? It's using these resources wisely, using our knowledge wisely, and the lessons learned wisely. And I intend to work as a partner with this body.
So let me tell you what I've seen happen in people who are in your seat. You come to the Budget Committee, we're all looking down like, don't ask for any more money, don't ask for any FTEs. And so departments will ask for less than what they really need. And so do you intend to lay out, because this is a multi-year, and all these change orders you just talked about, do your maintenance contracts include those change orders, or you expect state employees to be able to manage those change orders?
Both.
It sounds like those will go on forever.
Both.
As your board needs,
Absolutely.
the licenses change. Okay, so my counsel to you would be to provide to the Budget Committee, give us the whole pie. This is the change that needs to happen at the legislative level. We need to see the whole pie in terms of, so we can learn and understand fundamentally what it takes to build systems and to maintain systems over time. It's going to take probably additional FTEs, a higher level of caliber of staff who are trained to manage these new systems.
Absolutely.
And so even if your ask is going to be this, at least present a plan so we can begin to really understand what it takes, because I don't believe the legislature understands that. And we have a knee-jerk reaction when you come in and ask for a dollar amount, and we go into this back and forth. Can you do without this? And then, as you know, going through the budget project, we will arbitrarily cut your FTEs by X because either LAOs advised it, budget staffs advised it. And then we don't know then the impact that will ultimately have on the success of the effort. Then next budget year you come back and you've fallen short, and it's, and so then we're looking at you like, what? I mean, it's a cyclical process. And so I think to help create the culture shift we all need to live in, so we can get systems that work. Present the whole pie, even if your ask this year is less. I just think that would be helpful for all of us to get our arms around these issues. Final question for me, Mr. Pro Tem. Structurally, moving on from Breeze, structurally help me understand the nature of your relationship as the director with the various EDs of your boards. You know, when I look at the structure of your department, there's a lot going on, and a lot of boards that have really different functions. And so help me see the org chart. Is it dotted line relationship in terms of their reporting responsibility to you? How does that work? Because I thought about it as Ms. Leyva asked the question about ICE and the issue that's come up, where it appeared as if even though DCA has this policy, maybe one of your entities kind of was out there in left field. So what's that relationship between you and the EDs of all these various boards?
You draw a very important distinction. Boards, it's a straight line to, bureaus. It's a straight line to the executive office, primarily myself and my chief deputy. However, boards, the executive director, executive officer of that board is a direct employee of that board and has a direct reporting relationship to that board. Having said that, I have very good relationships with those executive officers and just as importantly, with those board members, the board president, vice president, and the board leadership. There are times where we disagree on issues, policy, and that is a board's job, is to promulgate policy that they see is in their best interest. The nuance with my department is we have more of a control of the administrative functions, budget, travel, et cetera, and that's where you hear the term semi-autonomous. That's where it starts coming in. The only difference or the only caveat I'll add to that, Senator, is if a board promulgates regulation that is inconsistent with consumer protection and consumer safety, pursuant to statute, I can deny those regulations and send it back to the board. Not just send it back absent communication. Send it back and work with them and explain where I'm coming from and how we can get to yes. So that's the nuance there. I hope that answers your question.
It does. So it's really relationship-based versus any kind of dotted line.
Absolutely.
And so then when those EDs are interacting with the legislature, it really is those EDs interacting with the legislature, not necessarily through you.
That's correct.
It's on their own.
Absolutely.
I would just say, I think lastly, I appreciate the fact that you were assigned as deputy director to be the point person for Breeze, but the fact that you as director have continued to be clear that the buck stops with you.
Yes.
And take responsibility for that, and to continue to be the kind of the lead point person is the right thing to do and admirable. So I tip my hat to you for making that leadership decision in terms of making sure that that you're the one who will be the point person on that contract. Go forward, and I wish you luck with it.
Thank you, Senator.
Thank you, Ms. Mitchell. We have one more question. Madam Vice Chair.
I just need a clarifying point to start with. My notes show that Release 3 much earlier in the year was taken out of the Breeze program. Is that true?
No, the contract was executed recently. The amendment was executed recently. That amendment was the exact amendment that removed the contractual relationship the Release 3 boards had with Accenture. So that was after Section 11 was passed, and after the financing and all of the internal mechanisms, we then executed that amendment. At that point, that's when we severed that relationship.
So the Board of Professional Engineers and Land Surveyors was in Release 3, so I'm assuming that it's not using Breeze. And
correct. When
Mr. Cannella said he got his license, he wasn't actually using Breeze.
Correct. He's
so
in the.
It wasn't breezy for him.
No.
Just, Senator Mitchell had a really good point. I'm not going to vote no today even though I have great concern, because I do believe that you're trying very hard to fix this problem, and I know you well enough to know that you will die trying. But I'm not going to vote yes either today. I'm going to abstain because I believe that I need to have some time to see some things come to fruition. And as to the question about how do we as a state manage a contract, it's true. This whole contract thing should not be on your back because we definitely, as a state, we have contract problems. But I'm hoping that by giving you a little time, that you'll be able to establish and model some new procedures for others and other departments. And I'm just going to ask you if these 3 things sound reasonable to you and if you can do these things. I don't feel significantly encouraged yet by your handle on the fees and how you're going to cure it, because I do think now where we are, you're going to have to deal with the money issue quickly and realistically, and it's going to be very unpleasant. And that if you would have brought forth a plan today that laid that out, I would have had a little more comfort. But the first thing in managing, I mean, these computer contracts are huge in size, and that's what complicates them. But they are generally simple in task. And if you want your huge state computer program to work, what you have to do for each of these boards is have a very simple flow chart of the task. Keep the task simple. There's an identified flow of what has to happen, step 1, and you try to keep it like under 10 steps. And then you give that as a protocol to the bidders, and you don't let the bidders bully you, as Mitchell has said. They will try to bully you and add all the little bells and whistles that brings these contracts completely out of sight. And so you have to stay very focused on those protocols, and you have to write it in the first test, you know, the test of when you roll it out. Remember the test that you've already done, that you roll it out, that if there's a percentage of defects beyond a certain point, that the contract is frozen and you will pay no more until they fix those defects. Because if you do not have those checks and balances in place, they get you to the point we are now, which is now there's no other vendor that you can go back to that has the blueprint, so we speak, for how far you've come. And so you just have to pay the full cost of whatever it is for all these change orders, as Senator Mitchell pointed out, and you have very little control. And these costs could actually triple and double. It could go to $300 million very easily. And we as the legislature, what we need to do to help you with that is we need to say that if there's only one vendor contract out there at the time you're going to bid, that you either are not allowed to bid that contract the way it exists without going back and simplifying the task in the protocol, or that there is a safety clause that says after we reach this particular cost, we aren't paying anymore and you have to provide. And if you're a very smart person, I know that about you. If you can stand up to this test, then I will be very glad to vote for your reappointment. In fact, I will probably take you out and buy you a drink.
I'll need it.
But I cannot at this time because none of those steps have been done, and you've been in the position for 3 years, and I haven't heard a plan to do it. I cannot do it at this time.
Thank you very much, Madam Vice Chair. Mr. Kandani, obviously you've heard fair or unfair. Obviously you hear a lot of frustration from members of this Senate committee, and perhaps more appropriately, your secretary or perhaps the Secretary of IT should be before this committee as well to discuss these specific issues and the continued debacles that have been articulated by almost every member on this committee. Obviously, the DCA has been plagued, obviously, from a $28 million to an explosion of $96 million that is before us today, which I can probably guarantee not one penny will be coming from this budget committee, at least on the Senate side, unless you can coerce the folks on the Assembly with the governor, to be helpful. So there lies a conundrum for future projected costs that you will have to face today. And given that it is so egregious that I don't think it would be a shock or surprise of oversight hearing, given this issue, to see what's happening, what's going on, and in fact, things are being done as being articulated. Ms. Mitchell makes some very poignant points with regards to this issue, because this issue obviously is larger than you, much larger than you. It's the legislature, it's the executive branch, it's the judicial branch. Quite frankly, I think it's the whole state of California, because we don't have the expertise. We're not ahead of the curve. The curve is ahead of us in terms of understanding this type of technology. That's correct. Clearly, I don't know. I don't even know how to do my own Twitter feed, so I don't know how to do this stuff. But there's a feeling that there's a small number of individuals who understand this perfectly well, and that they game the system. And I don't know if that's an IT cartel that exists out there, that, and I just made that up right now, who understand this very well, and they know what contracts they're submitting, and they know how to get on the back end with change orders, continuous change orders that they can rationalize and justify to the point where everyone's stuck. And I guess we're so much into it that it costs us so much more to abandon it with egg on your face and taxpayers being angry and upset.
That's right. So
to get out of it, it's going to be another 25 or 35 or $40 million, hence the debacle LA Unified School District with regards to a consulting firm and a software company, and the debacle with regards to teachers being underpaid, overpaid, or not being paid at all whatsoever. But if you wanted to fix it, we can do it. But it's going to cost you this much more to get it. It sounds like a drug dealer to me. If you want the fix, you want to get out of it, it's going to cost you X amount of dollars if you want to get out of it. Yeah. And we don't have the staff, whether it's DCA or just not your department, but all the other departments that exist here, and including us, the legislators, as well as the staff, that sort of expertise. And we hear these stories time and time again of the litigation and lawsuit, especially school boards and the small, not even small, mid, large cities of these debacles, and they leave and they move on and move on and move on and move on. Because I don't know if the litigation is the cost of doing business that they factor in ultimately, that they can spread over a course of time, that it becomes a very highly profitable situation. So you're in a pickle, quite frankly, with what you inherited. I would say, welcome to the club, because, that's what happens. You come in and everything that's happened before you, all of a sudden, I can tell you from personal experience, I would say welcome to the club in that sense. You mentioned a couple of adjectives to describe yourself, effective and dynamic. I do believe you're dynamic, and I believe given the opportunity, you'll have an opportunity to prove the effectiveness with regards to this. And this is not the only situation. Sure. There's a lot of other things that I know that you'll do extremely well at the helm of the Department of Consumer Affairs. This is something I think that you should stay close with the legislature to give continuous updates. And if I were you, I would actually poke and prod your secretary, as well as your secretary, and I don't know what the official title is of IT. I'm sure the executive branch right now, as we speak, is making those notes right now, and they go downstairs and get on the phone and start calling who they need to call, because this is a continued sort of ongoing saga, whether it's the state controller with the situation, whether it is the DMV, whether it is the Secretary of State, and this is the issue of Breeze. But what's before us right now is you as an individual, and whether we have, can you please turn that on? And whether we have the confidence in your abilities to lead this department. And I do believe, the confidence is there. And even with those individuals who may be holding back, I feel the sense that we believe in you as an individual, and we understand and recognize what you've inherited. With that, I would say to stay close, with us so we can work in a constructive, positive, proactive manner so it doesn't become the highly politicized world that we are in, right, with the finger pointing and the scapegoating, and then, I got to cover my flank here and I got to cover my flank over there. And at the end of the day, who got fleeced were the taxpayers, and everyone's got egg on their face, ultimately. So with that, I think I speak on behalf, at least on, a few of my colleagues right now, that we're very proud to move forward with your nomination. Your nomination, assuming passage from this committee, will be heard before the whole Senate floor. What I would highly recommend is between now and then that you engage other members of the Senate body as well. But nonetheless, the recommendation from this committee will be to move forward with your nomination. We do collectively wish you the very best, and we do believe that you have the ability, the skill set, the temerity, and the dynamism to do what needs to be done to be an effective legislator. I'm sorry, maybe that's in the future, effective director, We're going to ask folks to, those who want to testify in support of Mr. Kandani, we're going to ask for brevity. You don't want to work against his nomination right now. So those in support of Mr. Kandani, please come forward.
Mr. Chairman, members, Mike Knutson here on behalf of the Automobile Club of Southern California. Very happy not to be a technology vendor at this point. We've worked with Mr. Kandani over 10 years. He's done excellent work. We think he will be a spectacular director, and we think he should be confirmed. Thank you very much.
Thank you very much. Next witness in support.
Mr. Chairman, Member Stephanie Roberson on behalf of the California Nurses Association, representing over 90,000 licensees who have skin in this game. I've personally worked with Mr. Kandani over the years, both in his post now and in the legislature. I think my licensees are getting the confidence restored that he would do what it takes to make sure that this BREEZE program is a success, and we fully support his confirmation. Thank you.
Thank you very much, Ms. Robertson. Next witness in support.
Mr. President, members.
Brevity, too, please.
Carl London, on behalf of multiple clients that works with the Department of Consumer Affairs, the director and his team, we found them to be very open-minded, communicative, hardworking, and really want to also urge your endorsement of his appointment. Thank you.
Mr. President, Eduardo Martinez, on behalf of the 40,000 members of the California Medical Association, pleased to support the director's nomination. Urge your support.
Mr. Pro Tem and members, Erin Niemela. I'm the Senate's most immediate past appointee to the Board of Registered Nursing for 6 years, threw in the towel, but the appointee before you did not. He's still sticking with it. And I just want to take my hat off to him, working with him as a board member under really stressful conditions. He is a visionary. He puts a lot of skin in the game. He's an out-of-the-box thinker, and worked with three DCA directors, and by far and away the best. Thank you.
Vanessa Hina on behalf of the California Society of Anesthesiologists, the California Ambulatory Surgery Association, and the Hearing Healthcare Providers of California, all in strong support of Mr. Kandani's nomination.
Good morning, Mr. Pro Tem and members. Pamela Gibbs, representing myself for a change. I am in strong support of Mr. Kandani's appointment. I am a former colleague, an advocate who's had the opportunity to work with him in advocacy of a very large regional education agency. He has been very trustworthy, very diligent, very hardworking in all of our efforts. And as a personal friend of the family, I can also vouch for his fine upbringing, and I urge your support.
Mr. Chairman, Michael Gunning, Personal Insurance Federation, and it's truly rare when you get to do a professional and a personal recommendation, and we're here wholeheartedly in support of Awit and look forward to your good work. Thank you.
Mr. Chair, members, Missy Johnson on behalf of the California Pharmacists Association and the California Society of Certified Public Accountants. We have worked with Mr. Kandani for the past 10 years in a number of capacities, and we have full confidence in his abilities, and we ask for your support for his confirmation.
Thank you. Next witness.
Good morning, Brianna Pittman with the California Dental Association, with 26,000 dental licensees, here in support of Mr. Kandani's confirmation. Thank you.
Next witness.
Mr. Chair, members, Chris McKaylee on behalf of Natoma Technologies, but also speaking professionally and personally for a number of clients from the funeral industry to IID device makers, et cetera. We've enjoyed a good working relationship with the department and the director, and know him to be very hardworking and conscientious, and I'm sure he'll do a great job in that position. Thank you.
Thank you.
Mr. Chair, members, Chris Clay of Allstate Insurance. I'm here to support the nominee, and he's hardworking, dedicated, dynamic, and a lot of other adjectives that he didn't say in his presentation, so I hope this board will confirm him. Thank you.
Thank you. Thank you so very much. Any other folks in support? Any other folks in support of the nominee? Those in opposition? Any folks in opposition? Mr. Kidani, you did a good job eliminating your opposition. You told them the hearing was at 1:30, didn't you?
Tomorrow.
Tomorrow. Those who are neutral on Mr. Kidani? Seeing none, we have a motion. Madam Secretary, we have a motion by Senator Holly Mitchell. Madam Secretary, please call the roll.
Senators Cannella? Aye. Cannella, aye. Leyva? Aye. Leyva, aye. Mitchell? Aye. Mitchell, aye. Fuller? DeLeon?
Aye.
DeLeon, aye.
Mr. Kidani, congratulations. Your nomination passes on a 4-0 vote.
Mr. Pro Tem?
Yes, ma'am.
If I may, I'd also like to introduce the young lady who's shadowing me from my district today,
by all
Sierra
means.
from Los Angeles, who is also with California Youth Connection. There she is at the door. Thank
Come
you.
up in front so we can see you. What is her name, Ms. Mitchell? What is her name?
Her name is Sierra.
Sierra.
Mr. Pro Tem?
Yes, ma'am.
May I also introduce a lovely young woman who is shadowing me today, Shakara Crawford from Long Beach. Shakara, can you stand up and wave?
Shakara Crawford. I guess nobody wants to shadow me. Yeah. If we can have the folks silently clear the room, we're going to still move forward on this agenda. What we're going to do is we're going to reopen file item number 1. Madam Secretary, please call the roll. File item number 1.
Senator Fuller? Aye. Fuller, aye.
Okay. Measure passes on a 5-0 vote. What we're going to do is before we get to our second file item on the agenda, that is Ms. Elizabeth Abbott, we're going to take file items number 3, file item number 3, C, D, E, F, G, H. We're going to remove I. We're going to take J. So in short, we're going to take everything in file item number 3 minus I, and we're going to go 4 through 8. We have a motion made by Ms. Mitchell. Madam Secretary, please call the roll.
Senators Cannella? Aye. Cannella, aye. Leyva? Aye. Leyva, aye. Mitchell? Aye. Mitchell, aye. Fuller? Aye. Fuller, aye. DeLeon?
Aye.
DeLeon, aye.
Measures passes on a 5-0 vote. File item number 3I. Mr. Gideon Krakoff. Madam Secretary, please call the roll.
Senators Cannella? Leyva? Aye. Leyva, aye. Mitchell? Aye. Mitchell, aye. Fuller? DeLeon?
Aye.
DeLeon, aye.
Mr. Krakoff passes on a vote of 3-0. Let's return back to file item number 2. That is 2B. That is Ms. Elizabeth Abbott. Welcome, Ms. Elizabeth Abbott.
Did you want to do the floor damage?
We already did that.
In this one? Oh, and those. Okay. I thought it was just...
Ms. Abbott, welcome. Good morning. If there's anyone you'd like to introduce, please do so, and we would ask for brevity in your statement as well.
Good morning, everyone. My
Good morning.
name is Beth Abbott. I am pleased to have brought my husband, Don Abbott, who is
Good morning.
supporting
Welcome.
professor at University of California, Davis. So canceled
just
classes
fantastic.
to come south.
Thank you.
Oh, well.
And which class would that be?
Two classes, one in literary censorship and one in the history of rhetoric.
Talking about censorship, right now. So welcome and good morning, Ms. Abbott, and please proceed.
All right. I'm delighted to be appointed to the Office of the Patient Advocate. I began my career as a Spanish-speaking interviewer with the Social Security Administration and proceeded to work in offices throughout California and all over the country, as a matter of fact. And I have also served as a federal employee as the regional administrator for the Center for Medicare and Medicaid Services that had the Western states and the Pacific territories. In the 9 years leading up to now, I was an advocate for Health Access California, presenting consumer positions to state agencies, which I enjoyed immensely. And I am very, very pleased to be responsible for the Office of the Patient Advocate, and here are what I hope to accomplish. We're a small agency, but I think we are absolutely deluxe. And I want us to be much more visible in terms of the services we perform and the information that we provide. And I want to make sure that we have quality interjected into the selection of health care for California consumers. We have two signature projects. One is our report card where we rate health plans and give them stars, and medical groups and preferred provider organizations. And we're about to unveil this summer the complaint data analysis from complaints that are filed with 4 health agencies in California: the Department of Managed Healthcare, the Department of Insurance, Covered California, and Medi-Cal complaints. And they total about 106,000 at this point. I am very proud to be part of this because we're the first state in the nation to have both report cards and complaint data analysis, which will soon be unveiled. So I'm happy to take your questions. Thank you.
First, Senator Leyva.
Mrs. Abbott, it was very nice meeting with you. I think you have a wonderful experiences to draw from and a wealth of knowledge to bring to the committee. We had some great conversation about that 106,000 complaints and what that actually means. I appreciate that you're working on that. I think you'll be a great addition, the right person for the job. Really what I wanted to just do is say thank you that when we asked for some of these for our district office, in less than 2 hours, they were in my office and are now on their way to the district office. So if that's any indication of how you're going to do your job, thank you very much.
Appreciate that, Senator.
Senator Cannella. I have no questions, so we will, if Senator Mitchell comes back in soon, we'll give her a chance. But meanwhile, will the witnesses in favor please come forward?
Good afternoon, Senator. Or good morning, Senators. My name is Anthony Wright. I'm the Executive Director of Health Access California. We're the statewide healthcare consumer advocacy coalition working for the goal of quality, affordable healthcare for all. We were the sponsors of the HMO Patients' Bill of Rights and longtime advocates for working to make the Office of the Patient Advocate more effective in helping consumers, co-sponsor of one of the laws that helped to revamp the office recently, and have been very active, as many of the senators know, here in the legislature with my colleague Beth Capel and other colleagues representing consumers in the legislature. We have been equally as active in the administrative side representing consumers, and for 9 years that work was done by Beth Abbott. And she has been remarkably effective, but also with a huge amount of both experience and expertise. And so those are just my 3 very quick points in terms of her experience. She came to us after a long and distinguished career of decades in public service, rising to the height of civil service, running the Medicaid and Medicare for the Western United States, for administrations of both parties. She then came after retirement, still wanted to contribute to the public, and so then came to Health Access and worked for nearly a decade for a consumer advocacy group representing consumers. And so really amazing sort of best of both worlds experience of being effective within government and bureaucracy, but also being shoulder to shoulder with community and constituency groups. She is steeped in this knowledge with regard to She ran 1-800-MEDICARE
Could I ask you to finish up, because we're doing very well here, and
I appreciate that.
we probably briefer
So
is
let me
better.
just.
Thank you.
She has a deep amount of experience, and I would just say, as her former employer, when I get asked, the number one question I ask is, would you hire her again? If this somehow doesn't work out, we'd gladly take her back.
Thank you. Briefly state your name and your support.
Chair, members, Gary Passmore with the Congress of California Seniors. I've worked with Beth, I think, since about the first week or two at Health Access, and I have actually recently also worked with her with the Office of Patient Advocate and some of the reforms and improvements she's trying to make. OPA is actually an important portal for Californians to understand the health care and to understand the quality of their health care. And nothing could bring me more pleasure than to support her.
Thanks.
you. Good morning, Kelly Hardy with Children Now, and my organization and the rest of the children's health organizations think Beth Abbott is just deluxe, and we're very thrilled to continue working with her on behalf of children.
Thank you. Perfect.
Madam Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty, the co-sponsors of AB 922 that reformed the Office of the Patient Advocate last year, and we cannot imagine a better person. She's taking the data seriously, she takes her charge seriously, and we're here in strong support.
Thank you.
Kimberly Chen with the California Pan-Ethnic Health Network, CPAN. We're a statewide health advocacy organization working to improve health in communities of color. CPAN has had the pleasure of working with Beth Abbott and know that she will be a strong supporter and advocate to making sure that all Californians have access to care and have linguistically and culturally appropriate care.
Thank you.
Brianna Pittman with the California Dental Association, here in support of Ms. Abbott's confirmation. Thank you.
Thank you. Are there any witnesses in opposition? If not, coming back to Senator Mitchell, would you like to ask any questions?
Thank you. I'll be happy to both move the nomination and just say that as a legislator, I am probably almost excited as you are about the rollout of your complaint data analysis, just because as a health committee member and chair of sub 3, to be able to really know if all of the consolidations and new program rollouts are really working in the best interest of the consumer, this seems to me to be the one data point that we'll have, both health department, all of the departments who are feeding into it, as well as legislators. So I'm looking forward to it, and I'm proud to move the nomination. Thank you.
Thank you. The nomination has been moved, and seeing no further questions, Secretary, please call the roll.
Do we have a motion? We have a motion.
Yes.
Senators
Mitchell.
Cannella? Aye. Cannella, aye. Leyva? Aye. Leyva, aye. Mitchell? Aye. Mitchell, aye. Fuller?
Aye.
Fuller, aye. DeLeon?
4-0. We'll close the roll at this time, and congratulations.
Thank you so much.
With that, we can adjourn the meeting. Thank you.
Good job.